Feeding Video 1, Introduction to Infant Feeding. Feeding is one of the most important and complicated things a baby needs to do. Because of this, we've dedicated 3 videos in this series to feeding. The first is this introduction, in which I'll talk about all the things a baby needs to do to eat successfully. In the second video, I'll talk about common feeding problems of young babies. And in the third video, I will show and talk about some of the ways you can help a baby having feeding problems. When feeding goes well for a newborn, it looks so natural it's easy to assume that it's a simple thing. It's not actually simple though. With every suck, the baby gets a mouthful of milk, which she then has to swallow, after which she has to breathe, before she sucks, then swallows, then breathes again. Watch this baby eating. Suck, swallow, breathe, suck, swallow, breathe. You can't see the swallows or breaths, but they're happening. Infant feeding is a complex task, requiring good timing and coordination. Newborn babies are especially designed to eat this way. Their very short necks position their swallowing mechanism to protect their airway better than an older baby or adult can. Their adorable chubby cheeks actually have an important job. The fat pads make the space inside the mouth smaller, which means the baby doesn't have to suck as hard to get the milk out of the breast or bottle as she would if she didn't have chubby cheeks. And, maybe most importantly, they are born with a few reflexes especially for eating. The rooting reflex, which helps a baby latch on for breastfeeding, and the sucking reflex. Unlike eating for adults, eating for babies is a workout. Their heart rate and their work of breathing both increase. It's as though the baby's going for a little jog. Did you notice how after several of these suck, swallow, breathe cycles, the baby took a break to breathe? When the baby takes that break on their own, we call it self-pacing. A baby who is feeding well will regularly take breaks to breathe throughout the feed. How often and how long the breaks are varies from baby to baby. Like most things with babies, there's a pretty wide range of normal. When you really break down all the things this baby is doing as she's eating, it's really remarkable. Newborn babies are designed to eat this way, and many of them do so with no trouble at all. But some do have trouble with feeding or swallowing. If you notice any of the following: noisy breathing during eating, wet-sounding breathing during or after eating, coughing during eating, or breath holding during eating, it can be a sign that your baby is having trouble with swallowing or with coordinating their breathing with their swallowing. Speak to your baby's doctor and ask for a referral to a feeding specialist, such as an occupational therapist. For a description of other feeding problems and ways to help, please watch the next 2 videos: Common Feeding Problems of Young Babies and Helping Babies with Feeding Problems.